Welcome and thank you for joining us. My name is Millie. I am the bilingual intake specialist at INCLUDEnyc. INCLUDEnyc is a New York City organization that works with families that have children and youth with disabilities. Today's topic is Applied Behavioral Analysis, also known as ABA, for infants and toddlers with autism. This is one of a series of live stream presentations that occur on the third Thursday of every month at noon. We will try our best to keep it under 60 minutes. We will use a chat box, so if you have any questions, please feel free to chat us and we will do our best to answer them. Everyone should have received a packet via email. This packet will also help answer some of the questions that you have as well. Today's guest is Ivana Guerrero. So she received her PhD degree in psychology, Learning Processes and Behavior Analysis subprogram, and specialization in developmental disabilities from the Graduate Center of the City University of New York. She is a New York State licensed psychologist, board certified behavior analyst, New York State licensed behavior analyst, and New York State certified special education teacher. Welcome, Ivana.
Hi, it's good to be here, Melanie.
So in addition to being a staff member here at INCLUDEnyc, I am also the parent of an adorable little boy named Julian, who is going to be 4 years old in April. He is also a child with a disability. So we began receiving services through early intervention. So early intervention is a program that provides services for infants and toddlers from birth till age 3. So we began our journey with ABA therapy at about 18 months. We initially started because Julian was nonverbal, had very limited means of communication, and really wasn't able to express any of his needs or tell me anything that was going on with him. So that was initially the reason why we started with ABA therapy. So we began therapy by getting him to point at the different things that he wanted. So, pointing at the milk instead of the juice. And then from there we went on to shaking his head yes and no to answer questions. It's been a very long road so far, but I'm happy to say that now Julian is able to communicate most of his needs and he is able to thrive in structured and routine environments. So since early intervention only serves children up until age 3, I referred Julian to the Committee on Preschool Special Education, pretty much thinking that he was going to continue to need services, and I was correct in thinking so. I referred him at the age of 2.6. It is a very long process, so it's better to start early. And right now he is in a classroom that uses an ABA style of teaching. He continues to make progress and is doing pretty well. So with that, I'd like to say that today's focus will be on young children from birth until age 4. So again, welcome, Ivana.
Thank you for inviting me. Hello. Just to tell you a little bit about myself, I have been working with children with developmental delays and disabilities for the past 19 years. I began as a special education teacher in preschool, so I would travel to children's homes, their Head Starts or preschools to provide special instruction. After about 7 or 8 years, I transferred to the early intervention program and began working as a special instructor providing applied behavior analytic services to children diagnosed with autism. After I received my license in psychology, I began conducting psychological evaluations to rule out or diagnose autism for the early intervention program. I also supervised home-based ABA programs for children who access these services through their insurance, and I work as an adjunct assistant professor at the Department of Psychology at Queens College and Lehman College, teaching classes related to behavior analysis, learning, and psychology.
Oh, that's great. So I want to start first by asking you, what is ABA therapy?
Applied behavior analysis is a science dedicated to the understanding and improvement of human behavior. Applied behavior analytic interventions focus on identifying socially important behaviors and use evidence-based interventions to improve those behaviors.
And can you give some examples on how it differs from other approaches?
Well, I'm sure that you know that there are many methods that are offered to families when their children are first diagnosed with autism. And I just wanted to refer back to the packet that you mentioned will be provided to the viewers. In that packet, among other information, under useful links, I included a book about controversial therapies for children with autism and developmental disabilities. It's a very important resource because this book lists any possible therapy that is out there offered for children with disabilities and autism, and research or lack thereof behind those methods. Applied behavior analysis is scientific discipline with its theory, applied and experimental branches, scientific journals, university graduate training programs, and professional standards and credentials. Behavior analysts are certified by Behavior Analysis Certification Board and or by New York State Education Department. As of 2014, we became a licensed profession. So in New York State, licensed behavior analysts can provide direct and indirect services to children with autism, or individuals with autism, I should say. And they can also supervise those who provide direct services and are not licensed or certified.
So can you give me an example of how ABA works?
Well, what is very specific to our field is that we take data to document progress, and I always get many questions from families, well, why do I need to take data? Well, if we are behavior analytics method, and we use behavior analytic method, we need to take data so that we can analyze them. And if a family has any therapists on board claiming that they provide applied behavior analysis and do not need data, maybe they use behavior approach, but it's certainly not applied behavior analysis approach. As you know, autism is a very broad spectrum disorder, and we see children that have quite severe impairments. They might be nonverbal, they might have additional diagnoses, so they require quite structured approach to learn. We also see children who might be very verbal when they're diagnosed and can be easily integrated with typical peers, and those children might need lesser structure, and all that can be provided when we use ABA services. The data show us if children progress well. If they don't, we can adjust those procedures or train the staff so that they can use the procedures correctly, and modify the structure of the therapy as needed for each particular child.
So it's really catered towards each individual child.
Absolutely.
So can you give me an example?
Well, for example, in the beginning we might have children who are tantruming a lot. They cry, they may have also some self-injurious behaviors such as head banging or head hitting, and it is usually because they cannot communicate their needs. So we will work on replacing those problem behaviors and teaching them how to ask for things in an appropriate way. So they can maybe point to what they want, or they can tap mommy on her hand to get her attention, or they can use speech to ask for what they need.
So I know when I first started ABA therapy with Julian, I was experiencing a lot of frustration, initially because he couldn't really tell me the things that he needed. And I noticed that once he was able to point at least at the things that he wanted, it did help with a lot of the behaviors. And then it also kind of just helped me as a mom feel a little bit calmer and knowing that he could tell me at least some of the things that he wanted some of the time.
Absolutely.
So what types of rewards do you use in your sessions, especially for kids with sensory issues?
So every child is motivated by different items, and it is part of what we do on everyday basis that we have to assess frequently what motivates the child to work for. So if today my student reaches for a specific toy that I have that he likes, I would use that toy to reward him for completing activities or answering questions correctly. It is always important that the child selects the reward and not us, because from experience, many times I would go and shop for toys to make the sessions for my students fun, and I would love many of those light up toys, and then my student would just walk away from it. So that would not be a toy that I would use with the child. Maybe if it's something important that we want to incorporate in the child's program, such as using toys in functional manner, I would introduce that toy later.
So I know with Julian, he does the stimming. So he likes to go kind of eye level with the toys and just move them back and forth. So when his ABA first started, she would tell him, first, Julian, we're going to complete this puzzle, and then you can play with the train for 1 minute. And what I really liked that she would do was use a visual timer to show him what 1 minute was. So for him, it was something that he was working towards. But I believe that the reason why, as you said, that it worked for him was because it was something that he wanted to do. It was a toy that he wanted to play with.
Absolutely. And also, as you mentioned, the stimulations, I would say that many students with this diagnosis do have some sensory difficulties, right, that distracts them from learning. It can be anything from being either undersensitive or overly sensitive to visual stimuli or sounds or taste or touch. So if we know that our student has that difficulty, we really need to make sure to identify what that sensory difficulty is to help them learn. I see many children who are very sensitive to sounds, sounds coming from their environment, from within the home, but also from outside, from the street. And those can be very loud in New York City. So in the beginning, I would make sure that the windows are closed so the sounds are muffled, and later gradually I would expose them to those sounds because they still have to live here and deal with it and not be distracted with it. So that would be something that we would do with any type of sensory issues children have. We need to help them not get distracted and continue learning. Also, I should mention, because you might know that we are known as the ABA people who feed children M&Ms, the edibles. The edibles are important to mention. So there's a large percentage of children, and research documents that with autism that have some type of feeding difficulty or feeding disorder. Therefore, if we see a child who has such difficulty, that child should be referred to a feeding specialist for evaluation first. It can be anything from difficulties with swallowing, chewing, food refusal, food selectivity, whatever it is, it should be first assessed by a specialized professional, and we are not those professionals, before we can plan to address behavior issues related to feeding. So if I know that child is fine and they don't have any other problems, with swallowing, etc., that can be very dangerous, right? Then we can address, for example, the food selectivity or food refusal or running away from the table during feeding times.
And that's something that's usually typical for a lot of kids that have autism and sensory processing as well. So since we're talking so much about ABA therapy, I wanted to ask, what are the steps to getting services?
Some children are referred to early intervention through their pediatrician. Some children are referred through their families or other professionals that work with them. But in New York City, families can call 311 and they will be referred to the early intervention program and they will be assigned initial service coordinator. That service coordinator will help with the initial intake, during which family should be informed of their rights and answer any questions or concerns they might have. They will be also offered a family assessment and asked for insurance information. And I think families should know that agreeing to that family assessment and providing insurance information is optional. Then they will have to schedule what is called a comprehensive evaluation, based on which eligibility for early intervention services will be determined. And before I continue here, I just want to make sure to say that if a child in fact receives a diagnosis of autism, they have the option of getting early intervention services and or services provided through insurance. As of 2014, as I mentioned, we became a licensed profession, so licensed behavior analysts can provide these services to children diagnosed with autism, and many insurances cover those services today. Going back to the initial service coordinator and comprehensive evaluations. If for whatever reason the pediatrician thinks that the child has a severe feeding issue, or if there is a severe or high family stress, the doctor can order the EI services, early intervention services, to begin immediately before the evaluations are done.
Okay.
If that's called an interim IFSP. If there's no such concern, then the evaluations will be scheduled with consent of the families, and the family can decide if they want the evaluations in their home or if they want to go to an evaluation site. After the evaluations are conducted, then the service coordinator will schedule an IFSP meeting. But before, I just want to mention that usually there are two evaluations done. One is developmental assessment that is usually conducted by a special education evaluator. And the second evaluation is done depending on the difficulties the child shows. So if the child doesn't speak, then the speech and language pathologist will evaluate the child as a second evaluator. If the child doesn't sit, doesn't walk, it'll be physical therapist, most probably.
Can parents request evaluations as well if they feel that it's necessary?
Absolutely. Parents can request evaluations, and if during those two evaluations providers notice any early signs of autism, they usually request what is called supplemental psychological evaluation. When either a licensed psychologist or developmental pediatrician will evaluate the child to rule out or diagnose with autism.
Okay. And I know that you mentioned the IFSP meeting, so it's the Individualized Family Service Plan. So what are the goals that are developed at this meeting?
So as I said, after the evaluations are done, the reports will be sent to the service coordinator, and they will submit the reports to the early intervention system in the early intervention program. And the initial meeting will be conducted with the early intervention official designee. It's always difficult for me to remember that because I know them as EIODs.
Yeah.
And that person will lead the meeting. The service coordinator should be present, as well as family, who can bring whoever they want to as support, so other family members or providers if they have any. And during that meeting, the eligibility for services will be determined. Usually if child receives a diagnosis such as autism, there is no question. The child is eligible for services, but they will talk more about what kind of services and how many services will be provided. Usually they recommend 20 hours of applied behavior analysis therapy, in addition to speech and language service several times per week, as well as physical therapy and occupational therapy. Those four are usually always recommended for the children. And during that meeting, family can ask any questions they have and express any concerns. Also, during that meeting, the family will be assigned an ongoing service coordinator. Sometimes it could be the same provider who began with them, the initial service coordinator, but if they don't have availability, then somebody else will be assigned to continue with the family from that point on.
I know for Julian, when we first had the evaluations, he was diagnosed with autism. And we got the 20 hours of ABA therapy, we got 5 days a week of speech and OT, and then also physical therapy. So to me, it was kind of like he had his own job, where it was like he had so many hours during the week that he was doing therapy. So to me, it was like, okay, maybe you have your job, I have to go to work too. But in the end, it was completely worth it, because especially through the ABA therapy, he did make so much progress. And then for anyone who's interested in the timelines of early intervention from the evaluations to the service plan, in the packet that everyone received by email, we also have kind of like an infographic that breaks down everything for you. So Ivana, after the evaluations, what are the next steps?
So after the evaluations are done and after the first meeting is conducted, right, if the family chooses early intervention, to go with early intervention, and IFSP will be developed, which is the individualized family service plan will be developed. IFSP is a legal document, so everything that is listed in terms of services and frequency of those services must be carried out. So again, the names of the agencies that will provide the services will be listed, frequency of those services, and also goals for each of those services. So ABA will have their own goals, speech and language pathologists their own goals, etc. And that document will be signed. Just to mention, if for example family decides to go with the insurance-based services, it'll be a little bit different in that they will have BCBA supervisor and direct service provider, and they might have the same amount of services that they would have through the early intervention program, but the supervisor must come to supervise at least once per week, usually 2 hours or more. And the board certified analyst also is in charge of training the family to help with the progress and maintenance of the skills. So the services are a little bit different, although there's a lot overlap in what we might teach. I was providing both, so I would teach more or less in the same way. It's just that in terms of progress reports, it will be a little bit different in early intervention, where every 3 months the provider needs to write up a report, and in the insurance services, it depends on the insurance. Sometimes we have to provide reports every 3 months, sometimes every 6 months.
Okay. And can you give me an example of like what kind of goal would go on an IFSP?
For ABA, it would be something like the child will use pointing to request, and we will have always a mastery criteria there, so it's usually 80%, so we should use either, I'll talk about it probably a little bit later, about the discrete trial methodology that we use that provides multiple opportunities for the child to respond. So it's usually at least 4 out of 5 opportunities should be correct, or 80% or higher for that skill to be considered mastered. So, and this will be an example of requesting skill by gesture. You could have also something like vocal imitation if the child is learning how to speak, or we can have the amount of time the child can be seated at the table without running away. All those skills that are foundational skills for a young child to learn, and skills necessary for the next step, next educational step, which will be the preschool.
So it's like a mixture around their daily living skills.
Absolutely.
Okay. And I know you've kept mentioning the service coordinator. So
Yes.
what is the role of the service coordinator?
We spoke about the initial service coordinator a little bit, right? They help the family from the time of the referral to the first IFSP meeting after the evaluations are conducted. And the ongoing service coordinator, it's really next to the provider team that will provide direct services. It's the service coordinator is a key person in early intervention that is supposed to help families understand their rights, help them with answering any questions, concerns they might have, looking for qualified providers for their child, for not just for ABA but any other service the child is supposed to receive. They also help with the transition to the preschool special education, and for that they will also have to schedule evaluations, and they also might help with obtaining additional evaluations if those are necessary for the child.
So I know that we have a question, but we will definitely go back to that question towards the end of the live stream. So since we are talking about the ABA providers, how is the selection of home-based providers made?
Again, we'll be talking a little bit about early intervention, a little bit about the insurance services. In EI, or I think this should be common for both if family selects either or both of them. The best is, I believe, to look for a family who was happy with the therapist. The referral would be the safest place to start. I would also suggest families to reach out to the ABA university programs, because that they might have many students, graduate students, that are interested in providing services and becoming board certified or licensed behavior analysts, and those students are usually highly motivated and they will be properly supervised. If that is not an option or a family cannot locate anybody, then the early intervention system as well as the insurance agency will send them providers. I always get many questions: how do I know if the provider is qualified or not? Well, you need to really ask many questions. I would always ask if that person is board certified or licensed by the state, or if they are at least involved in any type of graduate or postgraduate certificate training to become board certified analyst, or if they're not, if they're properly supervised by board certified analysts. So in early intervention, the early intervention program, many agencies do have board certified behavior analysts on staff and some don't. So you want to look for an agency that does, and that makes sure that the providers receive ongoing training in ABA. In early intervention also, because of the type of setting it is, who provides ABA therapy are usually special education teachers. So families should ask specifically what qualifications their provider has in ABA, not just in special instruction, because as you know, like, we can have a special educator who has 15 plus years of experience working with children with different delays or disabilities, using anything else but ABA. But maybe they had initial 6-hour training in ABA with their agency, and that provider might be sent to your home. So you need to make sure that you question and ask.
So I do have a question. What can we do if our service coordinator cannot find service providers for us? So what happens when there are no providers available?
Well, if it's in early intervention, I would address it with the supervisor of this service coordinator. And if they still cannot help the family, I would then suggest that the family call the IOD, the official that held the meeting, that was present during the meeting, because they should be able to help.
So I know I actually had this problem when I was in early intervention with Julian as well. And what I also did was I actually called around to some of the agencies that I know provided the ABA therapy. And I was able to find some agencies on my own that did have openings within service providers. And then also I called the early childhood direction centers.
Yes, that's
So
important.
The direction centers information is located also in an information packet for each borough. And a lot of times they're actually able to help troubleshoot some of the issues that they're having as well.
Yes, and also I think that it is important to understand, and many times parents don't understand, because I don't think that is a priority when they begin the services for their children, that your services do not have to come from one agency. Usually when you're assigned the ongoing service coordinator, they work for a particular agency, so that agency will try to provide all the services that are mandated by the legal document, that is IFSP. Mm-hmm. But if they cannot locate providers, you can reach out to any agency that you want that is approved in New York City to provide ABA, if we are talking about ABA providers. So you can, if the service coordinator doesn't provide, says that there are no providers in that specific profession, mm-hmm. ABA or anybody else, you address it with I would address it first with the service coordinator supervisor, if not with the early intervention official, mm-hmm. and just reach out to, 4 or 5 other agencies that are approved to provide ABA, and I'm sure that you will find somebody.
So we keep talking about the ABA therapists. So yes. In terms of training, how much training do they actually receive?
That's a very good question. You can get somebody who is sent to you who actually is a special education teacher who is in ABA program near finishing and becoming a BCBA. Rarely you would get a BCBA to provide those services, in which case that person doesn't necessarily need supervision. They have to anyway, complete many continuing education trainings to maintain that certification. So you might get somebody like that, or you might get somebody with many years of experience not using ABA. If you don't ask, you will not know. I really urge parents to ask. It's very important to know in the beginning, because this time of your child's life is very precious, and you don't want to waste any of that time. So when we talk about how do you know? Well, you need to ask. You also can ask any other families if you know if they have experience receiving ABA services from somebody who is qualified, run it by them, ask them questions. But you can also access important information on the website that is provided in the packet on the Behavior Analyst Board Certification website.
So what are some of the warning signs that a therapist may not be highly qualified? So we have to take data. If you have a provider who doesn't take data during the sessions, that provider, I can assure you, doesn't use applied behavior analysis methodology. So you will need to address that. We either have
ABA binders in families' homes, or nowadays many agencies use tablets. But if there is an ABA binder, it has to include list of all goals for your child, and then the data sheets, daily data sheets taken every session, and graphs for that are made based on those based on data taken from each session. This binder should be accessible to the family at any time. I, for example, leave that in the bag with materials in the family's home, and they can look at it any time they want. So that should be absolutely accessible. Another warning sign would be if you have the therapy for 3 weeks and you see the therapist every day for 2 hours at least, right? Because you will have probably 2 therapists providing those 20 hours, and you don't see any progress, or you don't see that the provider is engaging your child. You might hear, well, we are just pairing with reinforcers, but in our field, I believe there is no such thing as pairing with reinforcers the first 2 weeks of the therapy. We have to do it all the time, otherwise the child will not be motivated working with us.
Yeah.
So, and even if we do that in the beginning, and even if maybe this, maybe in the beginning the structure will be a little bit looser because the child doesn't know us, we will still be working, and we will still be working on all those programs. Maybe the child's responding will not be that high, but it's not an excuse not to do anything during a 2-hour session. Another concern that I've heard over the years from families was that a feedback they gave me, well, we didn't like the previous ABA therapist because the child cried the entire session. So no baby should be left to cry for a long time. It is normal at the age of 2, as we know, to fuss a little bit. But if your provider is saying that it is normal for a child to cry for 30 minutes. It's just part of the process, and that's how ABA works. That's not true. We know better, and we know what to do, how to keep children comfortable.
Yeah.
Again, another concern that a family expressed, my child was kept in a high feeding chair for a 2-hour session without any breaks. I can assure you that was not an ABA therapist that was properly trained. I also would not suggest therapy in a feeding chair because of the position of the chair. You kind of incline backwards, which is not very natural. And
as you mentioned, you really want to meet the child where
absolutely.
they are and work with them.
Yes, and you want them to be comfortable. You can imagine if you're taking class at a university because you were very interested and they strap you for 2 hours.
Yeah, exactly.
So, it is difficult for the families when they do not have experience with this particular methodology or with any other, and they just trust the professionals who walk into their homes. But we talked about it before. You know your child the best, and you should trust your instincts. If something doesn't feel right, it's not right, and it needs to be changed, it needs to be addressed. And everything that we do as ABA providers or any other professionals, you should feel comfortable with it, with the goals, with the procedures that we use, with everything. If you don't feel comfortable, it needs to be changed.
Yeah, and I mean, I experienced something very similar with Julian. We were working with an ABA provider where we were about 2 months into the sessions, and when she would come through the door, he wasn't excited to see her. He would start crying, or he would be crying for most of the session. So that for me I took as a sign to change the provider because I felt like it wasn't working, and I trusted him enough to know that he wasn't comfortable with the provider. So since we're talking about working with providers, how is the infant or toddler's progress measured?
So if the babies in the early intervention system, they're usually reassessed by using some developmental assessment on 3 months basis. So I know that, and this is not talking about ABA, it's in general. Usually the developmental assessment of young children is the DAISY assessment is used, or the help checklist is used often in EI. And in addition, if the child receives ABA, we should use behavior assessments. So VB-MAP is verbal behavior assessment is often used for children to track skills, and when child masters specific skills, you know immediately what is the next skill to teach. So it's very helpful for providers to set up those programs, and again, the VB-MAP can be used on 3 months basis for us to compare the child's progress to how he or she functioned 3 months before.
Yeah, it goes back to all of the data.
Yes, and absolutely, based on the verbal behavior assessment, we'll set up our behavior programs and measure progress by using data every day during every session. And I should mention, if we didn't take data, it would be so difficult to look back and look at the way how each child learns, because if you ask me, no matter how many hours I work with one child per week, if you ask me how this specific skill looked 3 months ago, I would not know.
Yeah.
So because we are dealing with children with developmental disabilities, in some cases with severe impairments and dual diagnosis, the data help us tremendously with providing very useful information, such as, for example, if the child shows great responding on Thursday, Friday, but on Monday the responding declines a lot, then, and we see this pattern over several weeks, then we know that we need to reassess something. The child is not maintaining the skill. What is happening? Do we need to provide additional training to the direct service provider? Or maybe the skill is too difficult. Maybe we need to teach some prerequisite skill first. Or maybe the child needs additional sessions during the weekend, so we can either schedule sessions during the weekend if the family is okay with it, or we can train family to help with teaching the skill and maintaining it. Not to mention that we work with many children who not just have issues maintaining their skills, but they have issues learning in general. The learning is very difficult across different skills that we teach in different domains. In that case, after we try to adjust the procedures, if learning doesn't happen, this is probably a good time to refer the child to see a developmental pediatrician.
So how long do the ABA services last?
In early intervention, children can receive services from birth to the age of 3. In terms of ABA services, they will receive the services from the time of their diagnosis to the age of 3. Then they transition to preschool special education, which lasts from the age of 3 to 5. Many times families supplement at that point with the insurance-based ABA services after school. And when they enter the kindergarten, it depends. There are many options, I think, in the Department of Education for children who do really well. But to my knowledge, the Department of Education does not provide applied behavior analytics services.
Yeah, not for kindergarten children. So since early intervention only lasts until the age of 3, when should parents start thinking about the transition to the Committee for Preschool Special Education?
As you mentioned in the beginning, as early as possible before the child's 3rd birthday. So I'm not really sure about the specific numbers, but I think that it should be 3 to 6 months before the 3rd birthday, so that all evaluators can come in and complete the reports and send it to the families. Another thing that I wanted to mention, in early intervention and preschool intervention and beyond, please make sure when your child is evaluated by anybody to get the report on time, so that you can review. You need to be comfortable with the findings. You need to have time to call the evaluator and ask them if they have any, if the family has any concerns, and also maybe make notes that you want to talk about and address during the upcoming meeting.
So we usually encourage parents to start requesting for the evaluations for CPSE at 2.6 because this way it gives parents enough time to get through the whole process.
Yes.
We also have an infographic in our packet that also discusses pretty much the timelines for CPSE. So we do have a question.
Okay.
How would a child in a CPSE program supplement with ABA at home through insurance or through CPSE, or would we have to ask for it if it is CPSE?
In preschool, to my knowledge, used to the CPSE provided so-called dual services earlier, where the child would be at school for 5 hours and had access to ABA services after school at home. I have heard that that is no longer offered to families, but you can either supplement by the ABA insurance services, ask your insurance provider if they cover the services, or if, and I think it's in the preschool, that's usually what parents do, or you can also go to impartial hearing to request ABA services.
So if you guys ever get to the point where you are going through an impartial hearing, I would definitely encourage you to call us here at INCLUDEnyc. It is a very long process, and we do have family educators that can pretty much just help you navigate that process so that you can understand it as well. So since we are continuing to talk about, the evaluations for CPSE, what is there a difference in the qualifications between someone who provides an evaluation for early intervention than someone who provides it for CPSE?
There is a difference or requirement in terms of psychological evaluation. So in early intervention, if a psychologist provides evaluations, that psychologist must hold a New York State license. And I believe there is not a requirement in the CPSE evaluations where state certified school psychologists can provide those evaluations. So the difference would be in early intervention, we would conduct more of diagnostic evaluations, and at the CPSE level, the psychologist will conduct those evaluations to identify the deficits and create potential goals that will be added to the child's IEP program at that point, right? So what is called IFSP, Individualized Family Service Plan in Early Intervention, becomes individualized educational program. I'm hoping I'm not making a mistake. IEP and preschool and beyond preschool.
And usually the way that I think of it for the difference of the goals for the IFSP and the IEP is, for the IFSP, I've noticed it's more daily activity goals, daily living skills, and then for the IEP becomes more educational based. Yes,
and also therefore the term family in the IFSP, family has a lot of input in creating those goals. So it's not just based on our assessment that we create a program for the child, but also we look at what is important for the family. So if family needs would like the child to be more social with them, playing with them more, those goals will be incorporated anyway, and therapy.
And is there any way that parents can obtain independent evaluations?
Yes, it's very important whenever those important psychological evaluations are conducted to also have an independent evaluation if possible. As you know, many insurances don't cover private insurances or cover them only partially. So one way how to obtain those evaluations is with the help of a Medicaid waiver. And I just want to mention quickly the difference between Medicaid and Medicaid waiver. Medicaid is given to families based on family income. Medicaid waiver is given to families based on the child's diagnosis or disability. So the way how to go, anybody can apply for Medicaid waiver. The way how to go about it would be call numbers, a front door number that is also listed in the packet. There's a specific number for each borough, and parents can call and say that they have a child with disability and they would like to evaluate if the child is available for Medicaid waiver. As you know, this process is very long and complicated, so families need agencies to help them go through it, and I know that
We do.
you do have educator.
So we definitely have family educators that if you're interested in applying for the Medicaid waiver is done via OPWDD, which is the Office for Pupils with Developmental Disabilities. So if you are interested, you can always call us and we can connect you to someone who can help you through that process and give you lots of guidance and information. So in the interest of time, I'm going to go to the next question. So what are some of the steps that parents can take, and how early can they start touring schools for preschool?
For example, if I have a child who is turning 3 by the end of the summer and should enter preschool in September, I would have probably reached out to schools the past fall, just to see when they will be able to come when I'll be able to come for a tour or visit a school, etc. Most of the schools, I think, begin the tours in January, as early as January. So if the family waits sometimes until they hear the information from the service coordinator, it must be quite late to get into those schools of choice.
So the earlier the better.
The earlier the better, and also go and see at least one preschool setting for typical children, one preschool setting for children that function in an integrated setting. So usually half of those children are typically developing and half of them have some type of delays. And if your child has more severe needs, also go see those settings so that you have some idea what skills need to be built for the child to be in a less restrictive setting as the child is progressing.
Okay. So I definitely want to go back to the other question that we had.
Okay.
It says, I have a student that likes to crumble all of her food before eating. Should she be seeing a feeding specialist?
As I don't know if she does it with everything she's eating. She might have issues chewing. Sometimes children do that to help themselves, ingest those foods. And if there's a concern, there is a feeding concern, I would definitely go and evaluate the child by a feeding specialist.
Okay. And then, is there anything else that you feel like parents should know?
I think that it is very helpful also to attend any type of workshops that will educate families about what we are talking about, because you'll be able to talk to other people. You can meet other parents that have children with autism too. That helps, right? So that families don't feel alone, as many of them have told me that they feel very alone. I would attend conferences because you might be able to meet somebody who can recommend some quality schools, or you can get involved in research and your children can learn skills that are probably otherwise not trained in the system that serves them. Also, if you don't feel comfortable with any of the providers you have, please ask your service coordinator to send you somebody else, and be specific what you want, who you want. The same goes for the insurance agencies. You can always ask for different providers, and you can also locate a provider yourself and bring them to the agencies. It's very important that you feel comfortable with whoever is working with your child.
Yeah. And usually we tell parents, you as your child's parent, you spend the most time with them, you know your child best. So we tell you, trust your instincts. So it's kind of like if you feel that it's not a good situation or a good setting,
yes,
trust your instinct to ask questions.
And also it's important that you're saying it because, you know, how long you can give a chance to somebody, right? I would say it depends on the frequency of the services. So if you have an ABA provider who provides 10 hours per week, if you don't see anything happening in 3 weeks, that's not okay. I would look into it. Another thing that I wanted to mention, please, if a child has diagnosis such as autism, I believe that it is a really good idea to see a developmental pediatrician. Those are specialized pediatricians specialized in different children who have different disorders. So you want to look for a developmental pediatrician who is specialized to work with to treat children with autism. That pediatrician will be able to address your child's specific needs and also refer further if necessary.
So we do have one more question. So it says, does the OT or speech therapist or PT have to be ABA certified?
No, they don't, but it'll be really helpful if they have some basic behavioral training. I know that in other states, I know specifically in Maryland, I know some therapists that are PTs and OTs, and they can only work with children diagnosed with autism if they get that training to be part of that ABA team, not here.
So again, it's definitely important to ask lots of questions. So before we sign off, I just want to thank you again, Ivana, for joining us.
Thank you so much for inviting me.
Thank you all of you for joining us. As a reminder again, you guys have the packets that have lots of great information as well as Ivana's contact information. But before we go, we do have one more question. Can a child be reevaluated before the yearly evaluation if there is concern?
I'm not sure if this question is about early intervention or preschool, but if a child receives early diagnosis, so for example the child is 1.5 years and gets the diagnosis of autism, usually that psychological evaluation will have a note from or recommendation from the evaluator to re-evaluate that child within 6 to 12 months.
And for preschool?
For preschool, re-evaluate it before they, if there is a concern. I don't think that the preschool evaluators would do that. If there is a concern, it should be the early intervention.
So for preschool age children, if there is a concern for parents and they feel they do so, yeah. So if
I would definitely conduct the re-evaluations, and they should address it with the administrator from the committee of preschool special education who is in charge of that particular child.
Yeah, and parents can definitely request re-evaluations. You guys can always contact us at INCLUDEnyc, and we'll be more than happy to tell you the process. So before we sign off, I just want to remind you guys that our next live stream will be on the 3rd Thursday, and it is on positive supports for young children with challenging behaviors. We look forward to seeing you at our next INCLUDEnyc Live, Real Conversations on Parenting and Disability.